Hi everyone, very good evening guys. I hope I'm audible and visible, and welcome to this very short session that we have before very close to the exam also, and precisely why I want to keep it deliberately shorter. So these are important video based questions. We don't know whether they'll be asked in the exam or not. It is all in the air. We are anticipating based on the recent FMGE exam that they would be asked. But if you look at the recent mock exam that NBE has put out, I don't see video based questions in there. I hope you've gone through whatever they've put out there. You have an option of highlighting, but what I feel is very nice and I hope it's implemented in the exam is there's an option of zooming in. That will help you a lot in radiology, path, micro images, where otherwise it doesn't make sense. So if you can zoom in and come to maybe the diagnosis of a granuloma or a giant cell, that is definitely going to help you. Although I don't see video based questions there, but they are saying that they might be asked in the exam. So yes, let's prepare. Just to calm your nerves right now, I'm not teaching you anything new. There's no new concept as such. Just because it's a new pattern of question doesn't mean you start reading new things, right? You have to read the same stuff. I'm going to show you the same motilities. You've done tumbling motility, you've done shooting star motility, you've done all of that with me in LRR also, right? Now I'm just going to show you a respective video of the same. Same goes for pathology. You've seen a cryostat machine. I'm just going to show you a frozen machine and frozen tissue inside it. That becomes a cryostat. So as I said, there's nothing new that you're going to study out here. I haven't counted precisely, but I think there are 15 to 17 odd questions that I have, and that's about it. So we do not anticipate that this will go across beyond 30 minutes. Meanwhile, I believe anyone who's asking me, ma'am, last day ke liye revision, I'm not giving you any more lists, any more PDFs. I think I'm done, and more than me, you should be done with PDFs, right? Your final list is your LRR. There are 30 pages of LRR of each subject, average. That is your final list. There is no more of a final list beyond it that I want to give you. Other than that, every day on Instagram, we have been posting topics. Those are 1-minute videos. That is your final list. Beyond that, I don't want to unnecessarily give you lists which you will not be able to fulfill. And then that further creates a FOMO and anxiety that I haven't completed something that was given to me, right? So that is also not correct. And for everyone who, yes, nervous, that's a good sign. If you're not nervous is what would make me nervous. If you are nervous, I'll be happier about it, because if you've studied, this means you're forgetting, and if you're forgetting is why you are nervous. So it's a loop, right? It's a cycle that follows. Someone who has not studied will not forget anything and will never be nervous. So take that as a positive sign. It's okay to feel nervous, but not to the extent that you stop studying. If that is the extent that you've reached, you need to do a little bit of a positive self-talk to yourself right now and tell yourself that this is an exam. This is not life and death. This is not something that happens once only in this entire century. This is going to happen every year. Every year the same drama unfolds. Every year the same, mock exam comes. Everything remains the same. So I'm just one particle in this universe who's going to go and appear for this exam on that day. The entire universe is not looking only on me. So for you, it is the most important part of your life right now. But if you look at it from a very bird's eye, from a very larger perspective, it is not something that is going to make or break the world based on this exam. So usko utna hi importance do. Don't get very, very emotionally, all of you are very emotional about it right now. बहुत ज़्यादा anxiety hai, there's a lot of panic, which is obvious, everyone goes through it. But you need to look at it a little mechanically right now and not emotionally. Having said that, let's start with the session. I am not going to give you MCQs. I'm a strong believer of the fact that last 7 days, 8 days mein aake you should stop doing MCQs. I have no MCQs for you today. I don't want to ask you anything. I don't want to test you on anything. I want you to sit back for the next 20 minutes. Look at these 15, 17 videos just like you watch any Instagram reel. Just watch it like that and move forward. That's इतना importance देना आपको इस session को, बस, not more, not less. Let me start. This is the first one. This is the toughest motility I feel, hence I've got it the first. So what do you see? You see something which is moving very fast. It's obviously an organism, true with microbiology. Then what I notice over here is, yes, some of you are calling it perfect. So there are two things. Some of you are calling it tumbling motility. Some of you call it giardia. So giardia kaisa hota hai? So I was expecting this answer. Most of you are calling it what? You're calling it falling leaf motility, giardia, और क्या options आ रहा है हमारे पास? Some of you call it the twitching motility that you see with trichomonas. None of these are, I'm not saying right or wrong. और क्या answer है? We are also getting tumbling motility that you see with listeria. So let me go one by one and figure out all these answers for all of you. When you talk about giardia, that should look like this. because remember that angry old man, that is one option. Trichomonas also pear-shaped organism, strawberry cervix, makes sense. Isn't listeria a bacteria? Shouldn't a bacteria look like rods because it's a bacilli? So do you think this is looking like a rod? This is not. Forget motility, apna basic yaad rakho na. So this is not listeria. Now the next is it falling leaf? Is this looking like a calm falling leaf like you see in those SRK movies where leaves are falling everywhere and everyone is in love? This is looking very chaotic. It is looking very panic, jaisa hamara situation hai. So right now you must be having those random muscle twitches everywhere. You might be, maybe your eyes are twitching because you're too stressed out. This is the kind of motility that I see over here. So pear-shaped organism makes sense. It is moving very, very fast. That makes sense. So twitching motility is what I would come to. Bas yahi teen motilities hain which I want to teach you today, where you'll get confused. Otherwise, it's not going to bother you. So that everyone agrees with me, this is twitching motility. आगे चलते हैं. This I think is an easy one. I can see there is a T-shaped needle that is coming up, that is going and it is piercing the PSIS. So is this bone marrow aspirate or biopsy? In case you're confused, you can further see in the next picture that how the biopsy is being taken out. You can see a bony 1 centimeter portion that is being coming out. So this is a bone marrow biopsy. This makes it a Jamshidi needle. This is done from PSIs, nothing tough in this. Now they'll ask you questions. So if they ask you that what is the ratio of cells and fat that you get in an adult when you do a bone marrow biopsy, 50-50, 1:1, 50% cells, 50% fat. That is what previous year question. Okay with this? Moving on to the next one. So over here, I can see something. This I gave in one of the Telegram quizzes also. Some blood is being added, pata lag raha hai over here. Beyond that, this is something different. They added some chemicals and now they're sealing it with wax. Wahan tak you didn't understand, but now you saw this picture. And here definitely what you see is blood tha. That blood is not looking like RBCs the way they should be looking. Those blood cells are actually looking sickled like this. So what does this become? This has to be a case of sickle cell anemia. I can see that sickling that is shown over here. Sickle cell anemia ke liye what test is done? So this has to be the sickling test. The only PYQ that they can ask you is this, कि वो chemical कौन सा add हुआ था? Yeah, so what chemical was added over there? So that chemical is sodium metabisulfite. That's the only question they could possibly ask you over here and nothing else. So sickling test, obviously for sickle cell anemia. What is the question added? What is the chemical added? Sodium metabisulfite. What was that paraffin wax? Why were they adding wax? Because do we know that sickle cells will only show when I will remove all the oxygen or hypoxia will be created. That is when the shape will start showing. So I'm sealing all the sources of air around it, so that there is no oxygen and automatically the sickle cells can show up. That's okay. Can I move on to the next one? Okay. Here you can see there are 2-3, before I start playing the video, there are 2-3 videos which I have kind of, put up together. So 3 procedures will be shown to you back to back. So you have to be fast in identifying. That I've just done to save you on a little bit of time. But before I start playing this video, do you kind of know what I'm going to show you? Do you see some bacteria and do you see the tadpole-like structure that is on top of it over here? As soon as I show you this tadpole, this is a bacteriophage, and this bacteriophage tells me it is transduction. So now transduction aaya to matlab ma'am the other genetic techniques also you will show us. So let's start playing the video. You can see how the bacteriophage has come, how it is giving away its DNA, and how that DNA is now mixing or is getting into the DNA of the bacteria, and how the bacteriophage is now taking and going somewhere else. So this is what? This is transduction. Look at the second procedure back to back. Do you see between the two bacteria there is a contact created? So ये क्या बन जाएगा? Can you see how the fertility plasmid is going to the next one? So now this becomes a case of conjugation. Contact wala conjugation. Look at the third one. Randomly some DNA is being picked up. No one is delivering, no contact, no bacteriophage. Randomly a DNA is being picked up. What does that become? It becomes a case of transformation. So these are the 3 things which I wanted all of you to see. And before I move on to the next one, that's really rapid. Bacteriophage aaya, everything to do with bacteriophage, I will always think of transduction. Bacteriophage kya hota hai? It is not a bacteria. Bacteriophage is a DNA virus. That is number 1. Number 2, if the transfer of genetic material happens through contact, like you can see happening over here, it is conjugation. How the fertility plasmid is being transported That is conjugation. That happens through contact. That is how antibiotic resistance most commonly goes. Finally, this is a bacteria that I see. Randomly a DNA has been picked up from the environment. Free naked DNA from the environment is being picked up. That is known as transformation. That's about it. Moving on to the next. Till now you know what this is. This is a light microscope. And till now you get labeling. Acha, if I don't play the video, because the video is, I've put it on 2x speed, so it's going to move very fast. But I believe all of you know this is a video that I took randomly one day sitting in the lab, just in case. I never knew that video-based questions back then would come as a day. But now that they have, this is a light source. I think everyone can see that. Can you see how I've put a hematology slide, one glass slide I have put over here? So what does this area become? This area becomes the stage. What do we have below the stage? This was the first line we read in our LRR also. What is present below the stage? It is going to be the condenser. So that makes sense. Now can you see these are all your lenses, and so many lenses, chota lens, big lens. What are the lenses? How did we learn it? 4, 10, 40, 100. Repeating once more, it is going to be 4, then 4x, then 10x, then 40x, and then 100x. So these are the 4 different type of lenses that I see. And finally, now I'll play the video for all of you. So this is exactly what I'm explaining. First thing, I'm trying to show you how the light can go up and down. So this is the light source. Sorry, the video is a little shaky because I've increased the speed. Then you can see how this is going up and down, that is the condenser. Then this is where the stage and the slide is. So that also makes sense. Now I'm rotating. Can you see this is the 4x? Then I'll show you the 10x. Then I'll show you the 40x. And then I'll show you the 100x. These are the 4, 4, 10, 40, 100. And finally, ye kya hai? This is the eyepiece. What is the magnification of the eyepiece that you have? That magnification is going to be 4x. The magnification of eyepiece is going to be, I hope it's visible. Yes, it is. It is going to be 10x. So if I repeat this, the objective lens is 4, 10, 40, 100. And eyepiece ka kya hota hai? That is going to be 10x. That is why in our LRR we studied what is the maximum magnification that any microscope can achieve. It is 1000x, because you multiply this max with this and you get 1000. So you realize na, confidence I hope is coming back. Ke hai to wahi image, wahi theory. They want to complicate it and give it into a, a video based question. It's their wish. Coming to the next one, I hope now you can answer these. What is this? Something that is going super fast. I mean, trying to zoom in and show you also. One thing I notice, are these parasites or bacteria? Are they looking like those pear-shaped organism, Giardia type? Nahi ma'am. They are looking like these rods. Hai to kuch bacteria type. And it is moving so fast that I cannot view it also. Vibrio cholera. So all of you, do you want to say it's looking like the shooting star or the darting motility? Vibrio cholera. Wahi rice water stools ka history, which I've told you has been coming in every exam of this year, will come up over here. It's going super fast. I don't think you need to know anything else about this. Moving forward, this is as easy as it can get. It is looking like a screw. It is moving like a screw. And you remember how we learned it? Patient is also screwed because this is a sexually transmitted disease. This is the corkscrew motility that we have for Treponema pallidum. By syphilis ka history, if you remember, syphilis was everything painless genital ulcer, painless lymph node. This is also okay with us, nothing new. But yahan par to it is so nicely visible because it's moving. If I had to look at it as a stationary screenshot, which is that microscope which works the best? And again, you remember it is going to be the dark field microscopy that you do, which is preferred for seeing these spiral organisms. Very good, done. Agla, what is this? It's all path micro mixed today because you're in that phase of your preparation, right? So I can see one GIF which I feel they could give in the exam if they wanted to give you actually video based questions. This is a flow cytometer. Flow cytometer mein do hi questions aate hain. If you look very carefully in a flow cytometer, as the cells are flowing, can you see one by one, one cell is going to fall. Some amount of light will get forward scattered. Some amount of light is going to go and get scattered towards the side. So there is a forward scatter, there is a side scatter, and bas yahi question hai, PYQ again. Forward scatter is going to be a measure of what? Size of the cell. Side scatter is going to be a measure of what? The complexity, how complex or granular the cell is. That is also done. Okay. I just request the FMG students that, see, when the NEET PG thing was going on, I was simultaneously teaching you and I was supporting the NEET PG students. Same goes for them. We are supporting you, but this is not the video where I would want to put it out, because I think on social media we are giving all the support, but we need to be very, very fair over here, right? We are fighting for you, everyone is fighting for you, but we need to be a little considerate that किसी का तो एग्जाम है, and you remember that time ना जब आपका एग्जाम था 10 दिन में. So all support for you, and that is of course going to go on, but probably these 20 minutes is where we also have to think of some students जिनका 10 days में 9 days में exam है, तो उनका anxiety level, as medicos we have to be considerate because no one else is being considerate for us, तो at least हमें अपनी community में थोड़ा considerate तो बनना पड़ेगा. So all support to you on social media. If you pick up my social media account, you've seen that time and again, but ये 20 minutes we need to be considerate towards them. Okay, coming on to the next. What is this? This is something all of you were answering earlier. So I've got you all the motilities, but I've spaced it in the entire session ke ruk ke dekho so that you catch your mistakes. Is this a bacteria or a parasite? So I can see ye to bacteria type lag raha hai. And this bacteria, is it moving like very fast? Is it like that darting motility? Nahi, dikh raha hai. I can see those bacterias. That is one certain thing. अगर बहुत fast होता तो shooting star motility होता, which is not the case, not Vibrio. This is moving like that drunk friend of yours midnight who's had a lot of drinks. So what does this become? This becomes the tumbling motility that you see of Listeria. The same question, that when will this be seen? This will be seen at a temperature in the 20s, 22 to 25. This will not be seen at a temperature of 37 degrees. I think this you've done. तो क्या क्या देख लिया? We have seen the pear-shaped organism which was twitching like our muscle twitches. That was twitching motility done. We've seen the fast wala shooting star wala Vibrio is done. We've seen the slow falling here there like a drunk person. That is going to be Listeria. आगे देख लेते हैं. Let's see more. Before that, what is this video showing you? Some tissue is there if you look carefully. कुछ तो ऐसा tissue है. Does this look like a block of ice? Snow? ऐसा कुछ लग रहा है? That it doesn't even seem like this. This looking like an endometrial or a prostate cancer biopsy नहीं लग रहा ना? It's looking like ice or snow. Are you trying to cut snow? No, I have actually put the tissue inside it and I have frozen the tissue. What do you call it? You call it a frozen section. Frozen को cryo बोल दो. You call it a cryostat machine. So actually when they want to show you cryostat, they will have to show you the cryo part of it. Either they will write temperature is -20, tissue is frozen to -20, -18. कुछ तो frozen बोलेंगे, नहीं बोलेंगे. So they will show you a block of, it's not actually ice. They take the tissue, there is a special gel and वो -20 पे it freezes. So that is why you are cutting that frozen section. Now what do you do frozen section for? Number one, PYQ, old PYQ tha. Whenever you want to see fat, and for what stain do you use for fat? Oil red हो, ये तो पता है. तो fat देखने के लिए best is that you freeze the tissue, you will be able to see fat with oil red. Second, what you use it more, especially in surgery, not just breast cancer, but किसी भी cancer का quick diagnosis करने के लिए. I have just given you breast cancer history because that's how it comes in surgery very commonly. That the surgeon is operating, he's taken the sentinel lymph node, the axillary lymph node, and he wants to see if there is metastasis in that axillary lymph node. So he immediately sends it to the pathologist. Pathologist has to give the report in 15-20 minutes because the patient is open on the OT table, right? So you can't make the patient wait for 2 days in that position that I will give the report after 2 days. I have to give the report, does that lymph node have cancer or not? So what do? I freeze that lymph node. I cut sections out of it. Can you see there's a blade? उस blade से cutting कर रहे हैं. Let me show you a better picture. This is not a frozen section because now you'll realize कि मैम blade तो है. Here can you see the tissue? This is actually paraffin wax. This is routine. Every time you send me a biopsy, I give you the diagnosis after 1 or 2 days because after all the processing, I am making paraffin blocks and I'm cutting the tissue through it. This is routine histopathology. But अभी क्या कर रहे हैं? After putting it in paraffin wax, I am cutting it. ये cutting वाले procedure को बोलते हैं microtome. I think these are the only 2 things which should worry you in today's session. Otherwise, everything is from the notes. Microtome matlab whenever you're cutting any tissue, that is known as microtome. But if you're cutting the tissue after freezing it, like over here, now that becomes a cryostat. So this is cryostat, ye wala yaad ho gaya. The next one is microtome, that also you studied. Let's move forward. This I think you've seen ample number of times. Blood bank ka history hoga. What is this machine in the blood bank? You've seen a screenshot of this in all your notes. Today it's a GIF. It's moving left and right, which is that blood product which has to be kept under constant agitation. platelet agitator. Platelet में क्या temperature पे रखते हो? We keep it at one of the highest temperatures in the blood bank, 20 to 24 degrees. That is why the shelf life of platelets is only 5 days. So platelet rich plasma is done. ओके विद एवरीवन. ये लेफ्ट राइट ऐसा बस इसी स्क्रीनशॉट को उन्होंने AI से थोड़ा मूव करवा दिया एंड दैट्स हाउ दिस मशीन इज कॉन्स्टेंटली मूविंग सो दैट योर बैग्स आर ऑल्सो कॉन्स्टेंटली मूविंग. दिस इज ऑल्सो डन. Okay, what is this? Let's see. As soon as I'll play it, you will not need any hint from me also. कुछ तो mixing is happening and here you go. What is this? I don't want to give you a history. कैसा लग रहा है? ऐसा क्या फोटो मैंने देखा हुआ है? Something coming up like a string, but this will not come as a spotter. Now I give you a history of rice water stools. And you're like, we know rice water stools matlab it is vibrio gives what test? A string test. तो वो string मुझे दिख रहा है. So nothing is coming to you like not throwing you in the ocean right like that कि अच्छा बताओ क्या है spotter. Everything will come with a relative clinical history. You will go through the history. If you can diagnose, very good. If you can't, then you look at this image or this video and then you're going to diagnose it. Next one is also simple. I think 2-3 more left. Very easy session today. So this is, I don't know, they're filling water in a bucket. They've put something inside it and here I can see what has happened. They are closing it with a lid. Now it's showing me something like a whistle on the side, जैसा हमारे घर के pressure cooker में होता है. This of course has to be an autoclave. You want to see it once again, you can. We will see this video once again. Why have I put water? Because autoclave को steam बनाना है, तो I have to put water in it, just like you put it in a pressure cooker in your home. You've put all your surgical instruments, you've closed the lid, you've made sure that the steam valve is good, then you made sure that your pressure, कितना pressure? 15 psi. So you remember 121, 15, 15, that's the temperature. Timing is 15 minutes, pressure is 15 psi, done with autoclave. I've not written it, but I hope from our LRR session you remember the control. Remember it is Bacillus stero-thermophilus, sorry for very short forms. Bacillus stero-thermophilus was our control, pata hai? Perfect. Moving on to the next one. This is something which rapid revision में तो है, उसी को मैंने थोड़ा सा video based बना दिया. So let's see, very short, 8 seconds or so. They are putting some white color discs on top of this. What are they trying to do? These white color discs क्यों लगाएंगे? So this is some culture media. Some patient का sample is there, they have not shown. Maybe it was a urine sample. Let's assume कुछ यहाँ पे ऐसा urine का sample लिया था, urinary tract infection का patient था. You want to know what are the antibiotics that are going to work. Yes, you are doing antibiotic sensitivity testing. So what are these? ये white color का discs, these are actually the antibiotic sensitivity के लिए different antibiotics have been put. The name of this agar or this method is the Kirby-Boyer disc diffusion method. Kirby-Boyer disc diffusion method लिखे, agar लिखे, it means the same. What are the, तो ये क्या है? What are these white color discs? तभी तो disc diffusion agar बोला ना, because this is actually a antibiotic. Different antibiotics have been put. But now the question is, कोई agar exactly use कौन सा होता है? So that is a PYQ that you have, little old PYQ. It is cation adjusted Mueller-Hinton agar. They might write Mueller-Hinton agar, they might write cation adjusted Mueller-Hinton agar, or they might write CAMHA. It all means the same. As long as CAMHA ka full form, short form, something around it is written, that is the name of agar. So what I've done, I've taken on this plate, which agar have I taken? CAMHA. On top of that, वो पूरा urine sample, जो भी patient का urine, CSF, sputum, whatever sample I got from the patient, I have put it up over here, and then I have put different antibiotics. Okay, there is one more test. The other video, I'm sorry, is a little like is painfully slow video. बहुत धीरे धीरे चलता है, but I think we'll be able to put it up. Something you are putting of the patient over here, I can see how it is getting streaked, कुछ urine, CSF sample, and now the same, see, I've just created an AI version of it, तो वो antibiotics लगा दिया. It's the same thing. You are trying to find out whether the antibiotic is working or not, resistant है, susceptible है, तो यही है वो पिछला Kirby-Boyer in an AI generated video. I'm just showing you different variations. You don't know ना, examiner real photo डालेगा, AI generated photo डालेगा. So we are just preparing ourselves. But then there is another, I think that's the last thing, last one or two things. This is Kirby-Boyer disc diffusion agar, but is there something better than Kirby-Boyer? Anything better than the next one, which is in front of you? E-test के नाम से जानते हैं. So what is this E-test? Again, you've done the same thing. You've done ऐसा streak करा, जो भी urine, sputum, whatever sample you had, you have ended up streaking it over there. And now instead of putting those antibiotic discs, disc nahi lagaya, disc lagaya hota, I would have called it disc diffusion, Kirby-Boyer disc diffusion. Here I have put a strip, and उस strip का नाम है E-strip. So this is the same thing. Antibiotic is now not on that disc. Antibiotic has now been put on this E-strip. That is why we call it the E-test or the epsilometer test. And same you will be trying to find out through a software or through manually that whether the antibiotic is working or not. The advantage is that the E-test, I'll write it over here, gives you minimum inhibitory concentration, because can you see E-test पे अलग अलग gradients है. You can see different gradients of antibiotics, same dosage नहीं है. So you will know minimum how much of antibiotic I have to give that will work for this bacteria, that will inhibit the growth of this bacteria. So minimum concentration is told by E-test, minimum concentration MIC is not told by the Kirby-Boyer. We move on to the next one. Yeah, so this I think was from one of your GTs. I've already taught you, ye repeat ho raha hai. So this is also a little, like what I say, painfully a little slow video because I didn't put it on 2x. You can see there is some transfer that is happening. What kind of a method do you think is this? Is this going through bacteriophage? No, bacteriophage nahi lag raha, so this is not transduction. Is this going through contact? Did the two bacteria meet out here? No, they did not meet. So what does this become? ये randomly किसी ने कुछ भी eject करा and किसी ने कुछ भी pick up कर लिया. Yes, this actually becomes a case of transformation. So I've shown you real videos, I've shown you AI generated videos. कुछ भी randomly ejected था. So like you can see over here, and that, like, yeah, now it's working. I can see some random reddish color DNA will be ejected from this bacteria, and then random red color DNA is going to be taken up by this bacteria. So this is a case of transformation. Let's look at the next video. Again, as I don't think you will have to see much, but जैसे ही मैंने यहाँ पे क्या देखा, oh ma'am, bacteriophage has come up. Bacteriophage is giving something. This is what? This becomes transduction. This is, I'm trying to make you do repeated spaced revision कि एक बार real video देखो, एक बार AI generated देखो, mixed bag में देखो, so that your mind is ready for everything. Okay, let's move on to the next one. This one, I believe. So over here you can see again two bacteria moving painfully slowly towards each other, but here I know there is some contact that is going to be created between the two, and as soon as contact is created, this one plasmid you will see will be going. It could be a fertility plasmid, it could be a resistant plasmid, and that plasmid is now going to go through this contact, and we are now dealing with conjugation. Perfect, you guys have got this right. As I said, this particular animation just turned out to be very, very slow, but we'll keep our patience that there is going to be a transfer that will happen someday. These videos will not come so painfully slow in your exam. Anyway, they do also. You will be smart enough to know कि contact हो रहा है तो पूरा transfer देख लेंगे आराम से, but I know contact हो रहा है तो conjugation is what they're asking me. Okay, these last two are just two quick revisions. I don't expect a video-based question on them, but since you are here 9 days before the exam, let me quickly revise. Number one, as soon as you will see the first chemical coming in, you should tell me, क्या गया? Crystal violet. Okay, so as soon as crystal violet is added, we are talking about the gram stain. After the crystal violet has been washed off, what, remember, come in and stain. Revise with me. Gram stain के बाद तो obviously crystal violet के बाद everything is violet. What do you add next? Iodine. So iodine has been added. That is the mordant that we have. This was the first slide of our LRR, if you remember. Crystal violet added, iodine added. Now what is the third step? Come in and. This means you are going to add the decolorizer, and the decolorizer is going to be in front of you. Some alcohol, acetone, like over here I can see ethanol added. So that is the decolorizer. So now tell me, after decolorizer, will gram positive be affected? No, gram positive shuru se purple hai. Gram positive will always remain purple. The gram negative are going to give away their particular color. So ab gram negative ke liye what am I going to add? I am now going to add the next chemical that will come up, which is going to come up. Have the faith, trust the process, as they say. That's the next chemical, that is saffron in red. So finally saffron in red added. Now you know the final result. Repeat with me. Gram positive ka end mein kya milta hai? Gram positive is purple in color and gram negative is red in color. This is done. Ye pad liya. So then, yeah, gram positive, gram negative shown. Let's move on to the next. The next one shows you what? This is another staining protocol that we want to study. You see the first stain and you're like, I know this. Carbal fusion means class has asked mnemonic. Carbal fusion added, TB के लिए में भी कर रहे हैं, cough with sputum का history होगा. What color does the organism get? Carbal fusion का color you can see it is a red color. Okay, after carbal fusion, before let the video move, you revise with me. What is the mordant over here? It is going to be heat. So I can see how they've transferred it onto the heating over here. That is done. After that, you will put a decolorizer, which you over here is H2SO4. Like remember for TB, it is 20 to 25% H2SO4. And then finally in the end, to make the background blue, what are we going to add? We will be adding methylene blue. So abhi heating tak to this video has come up. After that, they will of course be adding that H2SO4 and then they'll go for methylene blue. So I think we are done. Meanwhile, everyone is revising ke heat nahi kiya hota, so it would have been the cold Zn stain. Cold Zn stain is known as Kinyon stain. That theory part of it is settled for you. And pretty much I am also settled after this. I have nothing more that I want to, just for the heck of showing you videos, I keep showing you random stuff which is not going to happen. This is the max that they can go to when it comes to video based questions. But then I thought that since you've joined in, I'll just ask you one random thing. It is not going to come as a video based question, ठीक है, tension मत लो. But I'm just asking you to find out, do you know this life cycle? I'll show you the first part of the life cycle and I know you know that. What is this life cycle? Before I start showing you the entire animation, कौन सा life cycle लग रहा है? I look at the egg and I'm like, I know it. Are these some eggs? I'm not going to name it. I'll keep showing you. These eggs are developing into something. They are picked up by some intermediate host. I can see a snail. ठीक है, snail से आगे जाके something development is happening. I don't have to go into the details, but finally there is a larva that comes to human beings and it is coming through water. So मतलब कुछ swimming का history होगा. Rest of it happens in the human being. I can see there is some development happening, some different stages it is going through. And finally the adult worms are formed. Adult worms are separate sexes. Now I think it makes sense. Sexes are separate. Spinous eggs. Snail is the intermediate host and Cercaria larva comes through the skin. Do you remember? Skin, Cercaria, snail, spinous, sexes are separate. Sara SSS, very good guys. This is schistosoma, schistosomiasis, whatever you wish to call it, all SSS coming into place. And that's pretty much the end of today's class as well. So as I said, I had kept 15 but very quick, very relevant videos. If it would have been a session, let's say 6 to 8 months in advance, I would have shown you all random stuff to prepare you for things which might come as 0.1%. Right now I'm very exam centric. I've shown you exactly what can be expected, but just my 2 words on it. I didn't see any path micro image based questions, video based questions in the FMG exam. I don't see any in the NB mock exam for NEET PG put up. My personal gut feeling for these coming up in your exam are pretty low, but again gut feeling doesn't work with NB. Many a times it is to do with anything can happen. It's very random, it's very unexpected. So even if that unexpected situation pops up, I have still prepared you for the worst. I hope you did not find anything that was worthy of anxiety or panic that many of you had before the session. ऐसा कुछ बहुत out of the box नहीं पड़ा, कुछ बहुत नया नहीं पड़ा. हाँ, the only place I feel as a feedback, because I know you guys want to know कि मैम कहाँ गलती कर सकते हैं, the only thing place where I feel you might make a mistake is going to be your a case of motility. बस वो देख लेना bacteria है या parasite है, the way you did in the first slide. Other than that, the motility part of it, if you're sorted with, I don't think it is going to be a problem. If you're feeling overwhelmed, anxious, panicky, my advice to all of you is that at this particular point of time, what I would suggest is that you go with active recall, the best. तभी तो मैम एंग्जाइटी हो रहा है, बिकॉज एक्टिव रिकॉल हो नहीं रहा. बट आई हैव टू टेल यू व्हाट इज़ द बेस्ट राइट नाउ. ठीक है, वो तो एक्टिव है, हो रहा है, वेरी गुड. यू डोंट नीड मी एट दिस पॉइंट ऑफ टाइम. यू आर सेल्फ सफिशिएंट. इफ़ योर एक्टिव रिकॉल इज़ नॉट वर्किंग फॉर वट एवर रीज़न, याद ही नहीं आ रहा, टाइम ज़्यादा लग रहा है, anxiety is not letting you sit at one place and study for that long because you're having so many distracting thoughts, so much of negativity in your mind. So then you go in for a passive study. Passive study का मतलब होता है you are going to play the LRR video, you are going to keep the PDF in front of you and you're going to do the PYQs thereafter. See, playing a video doesn't mean कि अच्छा LRR was for 3 hours, so I keep listening to a video and like a podcast I'm listening to it for 3 hours. No, it is like you play to start with your momentum, to gain momentum. नहीं हो रही पढ़ाई because you woke up at 8 in the morning, you were feeling very anxious because overwhelmed with so much to do. So you decided, let me play a video. Within 30-40 minutes, maybe my anxiety levels will come down, and then I'll gain the momentum, and the next 2 hours I really don't have to listen to the video, but I'll get in the loop of memorizing it on my own, doing my active recall. What you're doing over here is, rather than leaving your books altogether and not studying and going into that rebel mode, you decided that, okay, I'm going to take a little bit of help. Ask for help, there is no harm. Take a little bit of help from your passive recall videos and just apply it, gain the momentum, get through with the rest of the day. Advice number 1. Advice number 2, सब कुछ करने का टाइम टेबल मत बनाओ. In 9 days, there is no superhuman till date who has been able to finish 19 subjects. There is a reason that the MBBS went on for so many years, because there is a way the 19 subjects have to be done. There is also a reason that people take 1 year, 6 months to revise this entire course, because no one can do it in 9 days. So when no one can, nor can you. Don't put that unnecessary pressure. अपना एक छोटा list बनाओ जो doable है, that in 9 days, as a human brain who also has to sleep for 6 to 8 hours, because sleep cannot be compromised at this point of time, who also wants to get a good rank in this exam. तो अब इस situation में what is doable, practically what is doable, and this is what I have as a list for you. LRR का PDF 3 to 4 hours on an average per subject, very much doable. अकेला PDF से होता है very good, active recall, best recall. नहीं होता, you play the video, you do the passive recall. PDF you have, so this goes hand in hand, and then you do PYQs. PYQs भी हो जाता है. Let's assume that you got into that mode and you were like, okay, I've done LRR, I've done PDF, PYQs हो गया. So then now is your wish. You keep doing custom module. Custom module, I will not put a number to it. Your wish. Whatever, see, your aim is 6 to 8. Priority क्या है? 6 to 8 hours of sleep is priority. That is the first thing you have to focus on, not to be compromised. 2 to 3 hours everyone needs for mental sanity. कुछ ना कुछ तो कहीं ना कहीं तो you will waste time. You're not studying for the rest of the day. Then whatever 10, 12, 8, whatever time slot you have kept, उसमें आपको इस order में जाना है. If you finish it, then you get going with custom module. If you cannot do custom module, then the bare minimum that I told you that you have to do, you've done. That is what is priority. Sleep, priority number 1. Sleep for 6 to 8 hours. Doesn't mean you're sleeping for 13, 14, 18 hours in a day. Priority number 1 मतलब 6 to 8 hours of sleep. Number 2, 2 to 3 hours of sanity. वो मैंडेटरी है. अब जो बाकी का 12 आवर्स बचा है, उस 12 आवर्स में से आप 10 आवर्स का भी आउटपुट दे रहे हो. 10 आवर्स 10 डेज, आई थिंक दैट यू हैव टू गिव, राइट. 10 आवर्स का आउटपुट में इतना तो वेरी वेरी ईजी टू डू. It is not tough. If you keep your mental state intact, तो 10 hours पढ़ाई करना is needed, and you can do LRRs and PYQ. That is not an unachievable target. But you wanting to do all the PDFs you've saved, stop asking why. I see so many of you asking for PDFs on Instagram nowadays. Why are you doing that? कब पढ़ने का प्लान है वो PDF? जो PDF है वो भी नहीं पढ़ा, और PDFs you are taking from everyone. You are asking people for more PDFs. Still I see people asking me that, ma'am, can you do one more round of quizzes for us? No, वो सब हो गया. Now you have to simplify your life. Stop complicating it. It's already very complicated. The examiner and the authorities have all the more made it complicated by giving you random centers in random parts of the country. People out there are anyway adding complications. At least you can add one less. So don't ask for PDFs. जो हैं वो भी नहीं होंगे. You have PDFs, you have bookmarked MCQs. They are all, you have a million screenshots in your gallery which you will not revisit. तो जब इतना information already है जो वैसे ही ख़त्म नहीं हो रहा, why are you asking people for more PDFs? Someone might be studying from a new PDF saying that, oh, this is where the exam paper is going to come from. So just do like a thumbs up to that person and say, good for you. I don't want to study it, क्योंकि मेरा जो खुद का PDF है उसी का विजुअल मेमोरी नहीं बना. एक नया PDF लेके आई एम जस्ट गोइंग टू ruin my preparation more. Stop asking me or anyone else for any other resource now. जो है वो बहुत है. That is what you have to do repeatedly, and the single best. All through these 6 months you guys were asking LRR कब आएगा, LRR कब आएगा. अब LRR आ चुका है, LRR ख़त्म हो चुका है. This was the time we do LRR for, okay? And now after LRR is over, you've got your PDFs. Now if you're asking us कि अब क्या पढ़ना है, so then what were you asking us for the last 6 months? Now don't change your wordings ना. You were saying LRR से पढ़ना है, अब LRR हो चुका है, तो अब LRR से पढ़ो. This is the most appropriate time to study. This is the day that LRR has been made for. This is the moment that I made that for. So now if you don't study it, then that's your fault. अब वो किसी की गलती नहीं है. This is what you do. You cut the entire noise happening around you. You do not listen to anyone else. You do not take any advice, even if it's coming from the most intelligent person. वो advice implement करने का time नहीं है अभी. Right now you be focused, razor sharp focus. 1, 2, 3, if time permits, 4, and the 5th is going to be me stepping into the exam hall. That's it. I don't want to listen to anything else. ठीक है? FMG students, of course, this is not the video where I will be talking about it, but if you see my Instagram, if you see any other social media, of course we are talking about it. I am talking about it, others are also. Ye wala session I have to be focusing, because right now if I give these NEET PG students the anxiety of a protest happening against NB and others, which is very valid, but इनका mindset भी समझो. 9 days before the exam, when so much of things are already happening and someone comes up with this, it can get very overwhelming. आपके लिए भी था, इनके लिए भी same है, right? So this is not the right moment. These 30 minutes were not the right moment. Otherwise the support is there without, I mean, you won't have to say that to me also. GT marks भूल जाओ, GT नहीं देना मत दो. I too never used to give a GT 1 week before my NE exam, because if it would have gone very well, great. But usually ऐसा होता नहीं है. Right now when you're already having so many things to do and so many things on your mind, the chances are that your GT score might take a dip, and then your mood takes a dip, and then your entire preparation takes a dip, and then it comes down to 0. So where I could have achieved an 80% of productivity, I end up achieving a 10% of it, and that is so bad. So right now, forget any number, anyone told you 7 GTs देने थे, 6 देने थे, जो भी करना था भूल जाओ. अगर इस time पे it takes a toll on your mental health, then you don't give any GT. You do custom module, that is GT only. Problem है जब हम उसे GT नाम दे देते हैं ना, then we put a lot of pressure on our mind that, oh, I have to get a certain number of corrects, I have to get a certain number of questions right, then कितना कहाँ गलती हुई, I am तो dumb person, मेरे से silly mistakes हो गई. That negative talk then just continues beyond it. Forget GTs, मत दो. टेंशन हो रही है मत दो. पुराने GTs का कुछ बुक मार्क करके रखा हुआ है, वो रिवाइज कर लो. यू डोंट इवन वांट टू डू कस्टम मॉड्यूल, ओके, यू गॉट एम्पल नंबर ऑफ बुक मार्क्ड MCQs टिल नाउ विच यू डन ओवर द लास्ट 6 to 8 months. वो रिवाइज कर लो. एज आई सेड, रूल नंबर 1 is 6 to 8 hours of sleep, and rule number 2, which includes all of this, is keep it simple. Do not over complicate it. जितना complicate करोगे आपको help तो नहीं मिलेगी, but you will end up messing your mental health so badly that you mess up your mental health. Then you cannot blame anyone else that your productivity or efficiency in the exam was low. Then वो आपकी गलती है. Taking care of your mental health is not anyone's job but yourself. So you talk to people who keep you intact mentally. You do the stuff which keeps you intact mentally. You block people for 10 days जो आपको irritate कर रहे हैं पूछ के कि what is happening in your life. Justifiable. Just be very selfish for the last 9 days. सिर्फ अपने mental health, अपनी preparation, अपनी life, अपना timetable, अपना schedule. 9 days if you end up being selfish, no one's going to blame you in the long run. Trust me on that. Everyone will understand. People who have to understand will. So, and that's what matters in the end, right? So again, I hope after this, no one will ask me कि मैम एक और PDF दे दो. मुझे नहीं देना. I have 100 PDFs. What if I drop 100 PDFs on my Telegram channel today? The first person you will block will be me. That's so much of negativity you created before the exam, ma'am. अब जो कर ही नहीं सकते वो क्यों PDF मांग रहे हो? Why are you asking more topics? नहीं हो सकता वो. LRR is your final thing. Stick to it. Have faith in it. And as they say, trust the process. वो तो आपको करना पड़ेगा. Okay, microtome and cryostat. Dr. Irfa, it will never come as a spotter. कुछ तो लिखा होगा. So maybe that breast cancer वाली history is given. So microtome just blade का नाम है. That blade can be put in routine also. That blade can be put inside a cryostat machine also. वो blade के साथ cutting process is known as a microtome. The same microtome, if I put it at a -20 degree in a cryostat machine, it becomes a cryostat or a frozen section. I hope that clears it. And there will be an all the best session, of course, like always. It's on 28th, if I remember correctly. In that, for 10 minutes, I will have other faculty members with me, because I think that's the right time when we will be telling you what is the safe number to attempt in the exam, what should you be doing in the last 48 hours, which is going to be a very short 15-minute session. Usse zyada nahi. I think we are settled for today's class. We can end it. स्टोरेज बैंक फॉर RBCs, RBCs के लिए रेफ्रिजरेटर होता है 2 to 6 degrees the refrigerator temperature. The you're asking me the shelf life. Now that will depend on the anticoagulant. If you have used ACD and CPD, then the shelf life is 21 days or 3 weeks. If you have used CPD and A added adenine, then it is 35 days, which is going to be 5 weeks. And if you have used CP sagum, then you are going to store it for 42 days, that is going to be 6 weeks. That's the shelf life of RBCs. So RBC ka shelf life depends on the anticoagulant that you have used. That was a doubt I think we have put up. Okay, for those who don't want to join the all the best session, safe number is bar 180 questions. They've promised us, hope they stick to their promise. I would have been in your place, I would have gone a little aggressive, because जब 200 से 180 drop हुआ, तो then obviously I'm expecting that every one rank, every one mark or one question up and down makes a difference of thousands in the rank. थोड़ा सा aggressive, like you go aggressive in an INI paper because of lesser seats and difficulty level, same way I would want to go a little more aggressive. I would definitely keep my target to be above 150. कितना above 150 I will mark, I will gauge on the day of the exam. अगर मुझे लगा ओवरऑल द लेवल ऑफ द पेपर इज़ वेरी न्यू क्वेश्चंस, न्यू योजनाज, रैंडम न्यूमेरिकल्स, रैंडम माइक्रोबायोलॉजी ऑर्गेनिजम्स, विच आई नो दैट ये कहीं सिलेबस में था ही नहीं, देन आई नो दैट मोस्ट ऑफ द पीपल आर नॉट गोइंग टू अटेम्प्ट इट. सो दैट इज़ व्हाट आई हैव टू, वो आपका अपना पर्सनल एक उसमें जाता है कि एनीथिंग बिटवीन 150 to 165 वाला, 150 के ऊपर तो करना ही है. 150 to 165 का जो द 15 क्वेश्चन थिंग दैट आई एम टेलिंग यू डिपेंड्स ऑन यू एनालाइजिंग द पेपर. अगर ऐसा है कि दो ऑप्शंस बहुत इजीली रूल आउट हो जाती हैं, आई एम स्टक बिटवीन टू ऑप्शंस, नाउ दैट इज़ अ वेरी यूजुअल प्रॉब्लम, एवरीवन विल बी अप फॉर इट, राइट? ये तो सबके साथ होगा. सो देन आई अटेम्प्ट, आई टेक अ स्मार्ट गेस, आई गो फॉर माई गट फीलिंग, आई ट्राई टू रूल आउट. But if I come across questions which I've never heard of, or all the 4 options are not making sense, it's something written in a different language which I do not know, I cannot comprehend it, सेफ इज़ टू लीव दैट क्वेश्चन. जहाँ पे 2 में स्टक हो गए, अटेम्प्ट इट. जहाँ पे कुछ भी नहीं पता व्हाट अंडर द स्काई इज़ हैपनिंग इन दिस क्वेश्चन, यू जस्ट टेक अ स्किप ऑन इट. बट या, दैट्स अ वेरी ब्रीफ ऑफ व्हाट आई वांटेड टू टेल यू. कस्टम मॉड्यूल टैग में PYQ तो अलग से कर ही रहे हो, तो कस्टम मॉड्यूल टैग में क्लिनिकल का टैग रखो एंड इमेज बेस्ड. I think these two are a must, over and beyond your wish. But these two are there. PYQ is obvious because you do that before going ahead with custom module. So don't do PYQs again, क्योंकि फिर वो repetition होगा, you're not solving new questions. I think we are settled. Yeah, okay. Thank you guys for joining in. I don't think anyone would be asking me for the PDF because videos ka PDF dena would not make sense. If you want, I can give you, I can try giving you these to you as random GIFs or compile them in one YouTube short of 1 minute. I think I can do that. Give me a day or two, but PDF mat mangna because iska PDF banega nahi, right? It won't make sense. Thank you so much for joining in. Study well. I'll meet you in, obviously I'm meeting you daily in the Instagram and Telegram stuff that is happening, which are just 2 minute of revisions that we are doing, very quick ones. But I think they're essential because they just make you revise so much in 2 minutes, as I said. They're just like LRR types, needed for this time and nothing beyond. Thank you. Study well. Keep the positivity no matter how much of negativity is around you. आपको अपना एक mental state intact रखना है. That is what is your sleep and mental state priorities right now. Thank you so much for joining.